Hi. Maybe you know me, maybe you don't. My name is Evan Foster, and I'm doing a Gofundme campaign to fund a program called Rolfing, Structural Integration. It's a bodywork method. It works a lot with posture and with fascia. Fascia is a connective tissue. Connective tissue it makes up a large portion of our bodies. That's even parts of our bones are connective tissue, and also even blood. But the main focus in Rolfing is fascia that it's like a wrap around the muscles. You can also think of an orange or a lemon when you open it up, and there's these little wraps of juice. So the skin around the juice, that's what we could call fascia. And that's also in our body. So the reason why this is important is because it allows them to slide together. And I find this is the anatomical aspect, but it has psychological and emotional aspects too. One of the things that I love about Rolfing is that it really talks about how the environment affects your system, how we sit in chairs for most of our lives, or how our habits for phones or for computers, and how that is the environment in which we live. If we continually use our bodies in a habit-forming way, this can have an effect upon the structure, which can result in pain. But this alone, being affected, will affect also my hip or down to my feet. And this fascinates me. This is a tensegrity model. It's basically like, you could say these are bones. These sticks are bones, and then these rubber bands are connective tissue, muscles and fascia, things like that. When you change one thing, you change the whole system. So moving one of these in a different position changes everything. And that's the way it is in our bodies too. In our feet, for instance, if we have something in our foot that gets painful and it's maybe short, it pulls on the structure, and that changes everything. It can change even something up here. So if this is my body and I want to change things, and I'm like, I gotta pull and tug at myself. I wanted to study movement in general, but also how I can help other people to experience their body. This is done through touch, but also through movement. So there's two aspects of the therapy. When a person comes to see a Rolfer, it's a dialogue. So the person is not going there to get fixed. And the practitioner will ask the patient, the person, about their history, why they have come. Maybe they have pain. Or maybe they want to know more about their posture or movement. Relationship is important. It's through relating with our own body and through the separate parts in our body that we can learn to find other choices. So sometimes one position is more painful than another. It's not that the painful position is wrong. It's that it's a choice, and we have other choices available to us. So if one position comes from an emotional pain of some kind, it's very okay. It's fine that we have that emotion. It's fine that my knee hurts. It might hurt for many reasons. But if it stays like that, then it can be chronic and it can be painful. So then we can have another choice. And this is something that I want to give to other people. It has helped me to communicate with myself and to communicate with other people as well. Also with my environment. So I've already completed the first phase of the program, and I still have two more phases, phase 2 and phase 3. And those will take place in Munich. And so the money will go towards the costs of the course itself, the cost for transportation, and also living expenses in Munich. Thank you very much for your time and your support. I would like to give it back. So anyone who needs help, who needs a session, I will gladly give you my time. And this might look different for different people if you are in my area or if you're somewhere else. We can work it out. I will always keep a space available in my practice for people who don't have money, because many people have helped me along the way. You can find details about that below in the description. Thank you.